We would like to thank the ICS for the opportunity to present this work. We have nothing to disclose. This study is part of a larger project that aims to reinnervate the bladder after long-term spinal root injury in canines. We were interested in exploring changes in receptor expression in our model because activation of nicotinic receptor can induce bladder contraction through a synaptic transmission between the pre- and post-ganglionic neurons. Our group showed that neuromuscular nicotinic receptors may mediate bladder contraction after surgical reinnervation. We also found that smooth muscle function was maintained after decentralization, suggesting that muscarinic receptors are present and functional. So the goal of this study was to use ex vivo studies to further evaluate changes in nicotinic receptor expression after long-term decentralization. Bladder tissues harvested for these experiments were from two different groups. The first group is the decentralized group, which included bilateral transection of all roots caudate to L7, the dorsal roots of L7, and the hypogastric nerves. Also, we have a group of sham-operated female animals and a group of unoperated males and females. For the ex vivo contractility studies, we first denuded the bladder of its mucosa and then dissected out smooth muscle strips from the middle bladder. We then suspended those strips in muscle baths, treated them with 120 millimolar potassium chloride, and measured their contractile responses. Strips were then incubated in a variety of antagonists for about 20 minutes. We then treated those strips with 10 micromolar epibatidine, which is a nicotinic receptor agonist, and we measured their contractile responses. All responses are expressed as percentages of potassium chloride-induced contractions. So the first antagonist we used in our study was atropine, which is a muscarinic receptor antagonist. You can see on the y-axis we had epibatidine-induced contractions as percentages of potassium chloride-induced contractions. We had two surgical groups, the control and the decentralized. And here, each point represents an individual animal which has a certain number of strips assigned to each treatment. So this is an average of strip response per animal. So atropine significantly blocked epibatidine-induced contractions in both groups, suggesting that epibatidine activity is dependent upon the muscarinic receptor activity. It seems that epibatidine releases acetylcholine from the presynaptic terminals, which acts on the muscarinic receptors that cause bladder muscle contractions. The second antagonist we used in our study was tetrodotoxin, which is a sodium channel blocker. Basically, tetrodotoxin blocks action potential mediated activity because action potential depends upon sodium channel function. So 1 micromolar of tetrodotoxin does not block epibatidine-induced activity in the control group, suggesting that epibatidine-induced activity in this group is not dependent upon action potential. However, in the decentralized group, we see a significant decrease in epibatidine responsiveness with tetrodotoxin treatment. So we speculate that decentralization disrupts axons that mediate bladder contraction and causes the nicotinic receptors that are responsible for this activity to migrate to along the axons rather than remaining at the terminals. So therefore, their activity become action potential dependent. We then wanted to see the effect of a neuromuscular nicotinic receptor antagonist such as atracurium on epibatidine-induced contractions. 5 micromolar of atracurium blocked epibatidine-induced contractions in the control group, but not so in the decentralized group. It's worth to note that atracurium in a micromolar range can also act on ganglionic nicotinic receptors such as alpha-3 beta-4. So epibatidine-induced activity might be mediated by neuromuscular nicotinic receptor or alpha-3 beta-4 or some other ganglionic nicotinic receptor. We then tested another neuromuscular nicotinic receptor antagonist known as tupocurare. In white, we represented strips that were treated with vehicle, and in black, we had treatment curve of curare. And we used 0.1 micromolar, 1 micromolar, and 10 micromolar. I just wanted to indicate that in some of the subgroups, we have only one animal representing the data that you see on this slide. So curare inhibited epibatidine-induced contractions at all concentrations in the control group and at 1 micromolar and 10 micromolars in the decentralized group. From these data, it seems that the sensitivity to curare was decreased in the decentralized group. We then wanted to see the effect of ganglionic nicotinic receptor antagonist on responsiveness to epibatidine. You can see that there was a significant decrease in epibatidine-induced contractions at higher concentrations of these antagonists. So at 3 and 10 micromolar in the control group and at 10 micromolar in the decentralized group, there was a difference in epibatidine-induced contractions after blockade, suggesting that alpha-3 beta-4 nicotinic receptors are in part mediating epibatidine-induced contractions. From this study, we conclude that epibatidine activates nicotinic receptors on the presynaptic terminals, therefore releases acetylcholine, which acts on muscarinic receptors to induce smooth muscle contraction. In the control bladders and based on the tetrodotoxin data, nicotinic receptors are likely located on the terminals, and these receptors may consist of both alpha-3 beta-4 receptors as well as the possible neuromuscular nicotinic receptor subtype. Decentralization may induce a relocation of nicotinic receptors along the axon rather than remaining at the axon terminal. Collectively, changes in the nicotinic receptor profile possibly might occur to recover bladder function after long-term decentralization. With that, I'd like to thank all individuals who were involved in this study and the funding source. Thank you all for your attention.